this is Gloria Capola from Massage Pro CE, and this is Massage School. I've created some video clips for you in order to help you master some of the techniques that maybe you've learned along the way but can't quite remember exactly how they were performed, or maybe you just need a different approach. So I hope you enjoyed these clips, and if you have any questions, please contact me, and I hope to see you at a continuing education class sometime in the future. Thank you. So welcome back to Massage School. Today we're going to look at clearing out right in here through the neck for problems that people may have with limited range of motion, or maybe anterior forward tilt of their neck, or maybe they even have different pathologies that they have been diagnosed with, similar to thoracic outlet or carpal tunnel, or maybe they just get headaches. So we need to look in this region, both anterior and posterior, and see what's going on. If you remember from school, we have the brachial plexus coming out through here, going underneath your rib through here, two of your nerves, and the rest, all three of them, go down to your arm. So let's take a look at our client today. And first I want to feel the movement in all different directions. So I have my finger up underneath between the vertebral spaces, kind of just lifting him up and down, and noticing what kind of movement or restrictions he might have in what spaces. I'm going to bring him over to the side. You can notice he's a bit restricted through there. Not quite as much on this side, but still restricted. So you always want to feel in different angles, in different ways, where does your client have freedom and mobility? Where are they stuck? Get that tissue warmed up. I'm going to turn the head slightly to the left. I want to get my thumb, here's your cervical spine, I want to get my thumb right in that laminar groove. I want to get up around the occiput, and I'm going to begin to move laterally and stop right over here. I want to move that SEM up and out of the way so I can start getting into these scalenes. Now, if your client is uncomfortable with this, what I have them do is I have them actually move their head into this movement. So would you rotate your head slowly to the right? And I give them the control over this movement. And often I can get deeper, if you see that. And often they'll take it into a space that you might not get yourself if you try to do it. So it's good to give your clients a little bit of the control. Okay. And come on back. Take your thumb and bring it down to the next section. Get in that laminar groove. And again, I could be rolling his head, but I'm going to let him do it. And my hand is just gliding and following all the way through until I can move that SEM up and out of the way. And you just take it as far as you're comfortable and stop. Okay, good. Come back to center. I'm going to come down a little bit further, you can see here. Drop the head. And now, is that tender in there? Okay, we found a good one. Okay, so let's just do a little bit of cross friction in here and try to loosen this up for him a little bit. I'm going to lighten my pressure on him. And you turn it. If you can't turn it all the way, that's fine. Just go, you're stuck right there, just stay. So tell your client if they feel like they're stuck or it hurts, just hang out. They don't have to roll all the way right away. They can take it at their own pace. And if you can't get it all the way, that's fine. This is not about no pain, no gain. This is about working within the limitations of the body. Good. Now I could feel where he's really, really tight, way back in here. And you can see that my thumb didn't make it over here yet. So we need to find out what is happening in this region where his traps and all those wonderful muscles, those tiny little splenius capitis, serratus, longissimus muscles are coming in here. And I'm going to see what movement I can get in here to get my thumb right up in here and get as close to C5 and down to C6 as I can. And I'm just going to hold this and kind of do a little bit of direct fascial work in this space. You okay? Okay. So we're just going to hang out here, be patient, and just wait for this to open up. Starting to soften a little bit? Mm-hmm. Yeah. So just roll your head a little bit, tiny bit to the right. And let's take that a little deeper. There we go, right there. Let's open that up. So you have to be patient and work with the body. Let it work at its own pace. And involve the client when you can into some of the movements, and you'll see that you'll get much better, significant results if you let them participate. Good. Feel that? Okay, see if you can roll in there a little bit more. So we take it, oh, good. Nice and slow. Right there. Let's hang out there for a little bit. So don't rush your techniques with your client. You'll see that you're going to get much better results if you slow down, you pay attention, you hang out in those spaces, and let that connective tissue open, the muscles soften. Come back, do some petrissage, do some effleurage. Check the movement again. Check one side to the other. Okay, now I'm going to come back, bring his head to show you again where we're going to be working in this posterior triangle. Take my thumb again, lift that SEM up out of the way. Now I'm going to roll him just a little bit, and I'm going to come all the way down. I'm not on the top of the SEM, I'm on the side. Now did you see how he squinched there a little bit? We found a nice tender spot in there, didn't we? So you got to pay attention to the reactions of your clients. Let's come through here, right in here where he's tight again. Move that SEM up out of the way. Get behind and glide all the way down. You could also do it with your fingers. Feels a little different, doesn't it? And this is a little more specific, isn't it? Okay, so he's got some stuff happening back here in his scalenes. Let's roll that SEM out of the way. Remember to be careful, you know, you got your carotid artery in this space in here. If you're feeling a boom, 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 please get off of it. If your client starts to turn blue, get off of it. Okay, now you have the SEM, you have two attachments in here. So the one that's going into his clavicle is actually where he's got some tenderness. So we're going to work the SEM a little bit and see how we can maybe help facilitate some of this process to open up. What I like to do, a lot of people have a problem getting into the SEM. Okay, I shorten the muscle. A lot of people bring it over here and elongate it and find they're popping off. I shorten it. I take my index finger, I bring it up behind it, and then I can compress right through here. You okay? Mm-hmm. Now if you got some of those really tight SEMs, this isn't so bad. You could try to like wiggle it a little bit, pull it away a little bit, just gently, and see if you can get some movement. You can also bring this head over a little bit more, shorten that muscle more, and hold the compression a little longer. Find out if they have any tender areas, like that spot there where I just saw his eyes go. Hold it for 8 to 10 seconds, let it release. Now, I love SEM work, and I'll tell you why. When I came out of school many years ago and studied neuromuscular and myofascial work, I bought the Bibles that I consider every massage therapist should have from Janet Travell, the myofascial trigger point books. And I had a client who had a lot of problems with her neck. She had had multiple car accidents, whiplash injuries. She had several surgeries, and the doctors were ready to do a surgery on her neck, and she really, really didn't want it. So some of her symptoms included a headache that radiated from the back of the head all the way up around the forehead and around the eyes. She also told me that when she would rotate her head, she'd get really, really dizzy, and often she'd even get tearing in her eyes. So I bought those books, and I began to search for her symptoms, and I found in there all this information under the SEM that related exactly to the symptoms she was telling me. So she came in for her session, began to work on her. She was very, very willing because she did not want that surgery. And she immediately began to tell me that in the spaces of the SEM, she could feel referral places that were coming in exactly the spaces that she was feeling her headache and everything that was described in Janet Travell's book. So I knew we were on to something. So we worked the SEM and the scalenes, and we did some compressions and little cross friction, maybe a little myofascial release. and her symptoms all subsided. And I used to write reports to doctors and all the different practitioners that my clients, were treating with, and she had a rehab nurse and a physical therapist, and so I sent them copies of the treatment that you're seeing today. I received 4 different phone calls from every one of her practitioners, wanted to know what I did, because she didn't need the surgery anymore. She didn't have the pain. I was really happy all this worked because I wasn't sure that it would. And she was really happy because she got her life back. So it's important for you to do your research, to have the proper books and information to help you in your practice, and to not give up on finding where you really need to work to get rid of the symptoms that your client may have. So if you have a client that's had a lot of neck injuries, and they're telling you that they get those kind of headaches, dizziness, tearing of the eyes, take a look in this triangle here. Address some of those scalenes and your SEM, and notice if that changes any of your symptoms, how they feel, and you might find that you just found the trick to relieving their chronic problems. Thank you.